Coming of Age is coming up next. I'm your host, Josh Newby. Today we'll discuss hearing loss, the social ramifications, and how you can make hearing aids work for you. But first, an in-depth discussion of breast cancer and genetic testing, as well as some treatment options. Stay tuned. Coming of Age starts right now.
As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll feel empowered to regain your freedom while retaining what makes you, you. We've been in the community for nearly 50 years, advocating for elders and supporting those who care for our parents and grandparents. We were there when your father's health began declining, when your mother needed companionship during the day. And guess what? We'll be there down the road when you need those services too. Now, join with us as we talk together about the aging issues that matter to you.
1 in every 8 women in the U.S. will be diagnosed with breast cancer sometime in her life. But the good news is that survival rates are high if it's found and treated early. Baptist Healthcare oncologist Dr. Nicholas Drake is with us today to talk about the different kinds of breast cancer, treatment options, and the role genetic testing can play in managing breast health. Dr. Drake, thank you so much for coming on today.
Thank you for having me, Josh.
To get started, share with us a little bit about your background.
When it all comes down to it, I'm just a small town country boy from a little one stoplight town in upstate New York. But I eventually got into the medical field and was able to complete my training and do my medical school at Virginia Commonwealth University in Richmond, Virginia. Continued on there and did my training in internal medicine and then ultimately hematology and oncology at the Massey Cancer Center.
Okay. And now you're at Baptist Healthcare.
Now I'm at Baptist Healthcare. I got an email one day with a beach chair and an umbrella and a white sand beach. We came down and the rest is history.
There you go. Now, something I learned, I didn't know, is that there's different types of breast cancer. So what are those different types and how are they different?
Sure. Without going too scientific.
Sure.
The breast cancer types are based on typically what cell they arose from. So there are multiple different cell lines within the breast, and on a broad view, it comes from where the cancer started. We further classify breast cancers into at least 5 different types, and that helps us to determine the best treatment for a patient.
Okay, and how are they different, and what do those differences look like?
Sure. So one of the big differences, and one thing that we test for on all breast cancers, is whether or not they are hormone receptor positive. And what that is female hormones, estrogen, progesterone. Some breast cancers actually respond to those hormones, and those hormones, in a sense, help the cancer to grow.
Okay.
So the way it works is if a breast cancer is estrogen receptor positive or progesterone receptor positive, that gives us a target to treat the cancer at.
Right.
So blocking those hormones. There's another marker called HER2 that we look at. So you have HER2 positive, HER2 negative cancers. And the reason why we test for that is because we have a targeted agent against that receptor. So that helps us to, personalize treatments for patients.
Gotcha. So what are the signs and symptoms of breast cancer? And I guess I'm curious if those signs and symptoms differ based on the type of breast cancer that you're dealing with.
They can.
Okay.
Absolutely. Yeah. The biggest thing with breast cancer is catching it early.
Right.
When there aren't signs and symptoms, unfortunately, which is why we have screening tests such as mammograms.
Sure.
But for the patients who do have symptoms, it would be, there's a new lump here that wasn't there before. A bloody nipple discharge or something like that.
Sure.
Dimpling of the skin or changes in the skin.
Okay.
What would be called peau d'orange, which is kind of the skin almost feels like an orange peel.
Oh, interesting. Okay.
Yeah.
Okay. And those symptoms vary based on the type of breast cancer?
The type of breast cancer, where it is, where the tumor is located.
Okay.
Absolutely.
So walk us through that diagnosis of the breast cancer. How do you, A, how do you figure out that it's breast cancer? And B, how do you figure out what type of breast cancer you're going to be dealing with?
Okay. So perfect. For instance, a woman goes in, has her annual mammography, okay? Screening mammogram, they do a couple of different views, and then the radiologist knows something that just doesn't look quite right.
Sure.
often those women will get called back for what we would call a second look or a diagnostic mammogram, a little bit more in-depth, but still very similar testing.
Okay.
At that point, if a area is identified that is of concern, they tend to go on to get an ultrasound and then a biopsy. Biopsy can be done via ultrasound, via MRI. It all depends on the radiologist and what they feel is the best way to biopsy and get an adequate sample.
Gotcha.
So then a patient gets a biopsy. That tissue is sent to the pathologist. The pathologist looks at it underneath the microscope and then determines whether or not it's cancer. Okay. After that, it gets special stains applied to the tissue, and we help to determine if it's hormone receptor positive or negative, HER2 positive or negative, and then we can figure out our treatment plan from there.
And how do you determine that treatment plan? Because I imagine that a lot of people, when they hear breast cancer, they assume surgery. That is the solution. Is that always the solution, and how do you determine that?
That's a great question. So surgery is not always needed for every single patient.
Okay.
What we do is we work with a multidisciplinary team, not only myself, but surgeons at Baptist, surgeons within the community, our radiologists, our radiation oncologists, our social worker at Baptist. We have a wonderful breast cancer navigator who helps the patient kind of navigate the entire treatment cycle and treatment course, because it can be very confusing for patients.
And intimidating and
Absolutely.
scary.
Cancer, that's the big C word.
Absolutely.
It's one of the scariest things that anyone will have to go through in their entire lives. So to answer your question, no, surgery isn't always needed.
Okay.
The cases where surgery is typically not needed, unfortunately, is where cancer has spread outside the breast, outside of the lymph nodes, and is at distant sites.
Okay.
The way I explain it to my patients is surgery is great for what you can see.
Okay.
You cut it out.
Right.
Right? What I do as a medical oncologist is I treat things that we either can't see or treat. My medications go throughout the entire body, so they get everywhere.
Gotcha. And so what do some of those non-surgical treatment options look like?
Typically, it's chemotherapy.
Sure.
We are coming out with newer targeted therapies for patients whose tumors have specific mutations.
Okay.
And there's new medications coming out all the time.
Okay.
Those can be oral medications. There's commercials all over. I'm sure everybody's seen them.
Right.
For certain types of what we would call like a metastatic cancer or something like that.
Okay. I'd like to switch gears a little bit. But before we came on, we discussed a little bit about genetic testing. I'm curious how that ties into breast cancer. So let's just start 30,000 feet up. Okay. What is genetic testing?
Sure. So genetic testing is looking at someone's DNA.
Okay.
Right? DNA is the structural component that makes up what we are.
Okay.
Okay. Genetic testing, you can think of actually in two different ways. There is genetic testing as testing what mom and dad gave you.
Okay.
Okay. But then we can also do genetic testing of your tumor as well, which can kind of separate those into two different camps. Okay. So genetic testing is, as far as what you inherited from your parents, can put you at an increased risk to develop cancer, not only breast cancer, but also other types of cancer.
Right.
And then when we talk about genetic testing in breast cancer patients, there are some guidelines as who qualifies or who should definitely get genetic testing. But there's also a new recommendation from the American College of Breast Surgeons, which says that everyone should at least get a discussion of genetic testing, which is what we like to do anyways.
Gotcha. So talk about that, the specific cases where genetic testing is definitely recommended, and also when in the lifespan it's recommended.
Sure. So genetic testing is definitely recommended and encouraged in women who are younger, less than 50, who have developed breast cancer. Okay. Or women under the age of 60 with a specific type of breast cancer called triple negative breast cancer.
Okay.
That's hormone receptor negative, HER2 negative breast cancers.
Gotcha.
And then that is going to look at different mutations that you have, that you possibly inherited from your parents, or you developed all on your own.
Okay.
All right. The implications for that we always like to discuss up front before testing.
Right.
Because those are potentially genes that you passed on to your children.
Okay. Interesting.
So that's where the implications go outside of the patient and more so down the line as far as their children, if they have children.
Gotcha. So is the genetic testing valuable to you as a doctor in terms of treatment, or is it really just determining, the cause and the future of it?
So it can be valuable
Okay.
in determining treatment, especially surgical options. So patients with certain type of BRCA or BRCA mutations, they may elect to have more extensive surgery to therefore decrease their risk of breast cancer recurring or even other cancers recurring.
Sure. So it gives you a fuller picture, essentially, of what you're dealing with. So, we talked about how early detection is paramount. But what about prevention? Is that a thing? Is that possible in terms of breast cancer?
It is a thing. There are different ways to decrease your risk for breast cancer.
Sure.
Okay. I always say it's healthy lifestyles, the things that we all know we should be doing, right? Exercising, 5 times per week, 30 minutes, appropriate weight.
Okay.
So not too skinny, not too big.
Right.
General healthy diet.
Really? Okay.
Lean proteins, fruits, vegetables, not too many processed things.
Okay.
That sort of thing.
Excellent. So just a generally healthy
lifestyle.
Gotcha. Is
not
best.
drinking too much alcohol.
Sure.
Obviously not smoking. Smoking's bad for you anyways.
Right.
I think we all know that now.
Okay, fantastic. And if someone doesn't have the healthiest lifestyle, has engaged in some of those risk factors, should they perhaps be tested more frequently? Should they take steps in any way?
No, I mean really the big thing for catching it early is doing those yearly mammograms.
Okay.
I completely understand that it is very uncomfortable for women to go through that process.
Yeah.
I have not been through one.
Right.
And I'm sure that if there was a male that had to go through it, we might develop a better way to do it.
Sure.
But unfortunately, that's what we have right now.
Right. Absolutely. Well, it's great information. I really appreciate you coming on. Thank you, Dr. Drake.
Thank you for having me.
Listen up. We have help for hearing loss next on Coming of Age. Stay with us.
Why do people love ACT's retirement life communities? There are more reasons than just the active lifestyle. Like ACT's Life Care, a plan that protects your nest egg with predictable monthly fees, even if your healthcare needs increase, so you can enjoy a carefree today and a worry-free tomorrow. Plan a visit and see why our satisfaction rating with current residents stands at 98%. ACT's Retirement Life Communities, where loving kindness lives.
What does it look like when a life is truly changed?
I feel a sense of accomplishment because I built a house. This house has brought us financial independence.
It's a great place to raise a family.
Strength, fuerza. When I look back where we've come from to where we are today, it makes my heart very happy.
Potential. Potencia.
For me, this house means all of us together.
Sorry.
Security.
Security.
Every family dreams to have their own house. This house changed our lives.
Habitat for Humanity is at work in your community and around the world. Through shelter, we empower.
Calls me googly eyes.
You know you're beautiful, right? You know that?
Even you're beautiful. I got bullied for wearing glasses. Share if you're against bullying.
We put it out there, just took off. 3 million people have shared this post. Don't let bullies get you down. I stand with you. Our whole family's wearing glasses. I wear glasses and I'm proud.
I even have the army on my team.
All the kind comments brought my child joy. I don't feel thank you is enough.
Next.
Since 1989, TLC Caregivers has been providing the special help people need to stay independent in their own homes. TLC is an employer of choice in the home care market. Our employees are screened with level 2 background screens, drug-free, and have caregiving experience. If you have time, enjoy people, and are interested in joining us, go to tlccaregivers.com to learn more about becoming a TLC caregiver or visit us in Cordova Square.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
Between 1 in 3 and half of all senior adults will experience some hearing loss. In fact, you may have trouble hearing me right now. But of course, there is a solution. However, it requires being honest about the fact that you may have difficulty understanding some people in some situations. If that's you, John Dennis is here to help. John, thank you so much for coming on today.
Thank you for having me.
So, just to break it down, what are some signs that someone is experiencing hearing loss?
There's a few things that you'll start to notice. You'll start to notice things sounding muffled, lower in volume. You may ask people to repeat themselves a lot, to speak slower, louder, clearer. You'll notice that the TV volume, the radio volume is going higher and higher.
Yeah.
And then eventually what it leads to is you withdraw from social situations.
Yeah.
You just start avoiding them because you can't hear that well.
And I imagine that it happens so gradually for some people that they don't really notice there's a problem until one day, they can't hear their grandkid across a crowded room or something like that.
Exactly. Just accumulates over years. So eventually you do get to that point where you have trouble hearing. It's usually soft-spoken people, or if they have higher tones in their voices. So usually the first to go are women's voices and then children's voices, just because of them being soft-spoken.
Sure. So is there a particular age group or demographic that's more at risk for hearing loss?
Yeah, well, some studies show that as many as 1 in 3 people between the ages of 60 and 75 have hearing loss, but they also experience hearing difficulty too.
Okay. So it generally is the older population that's most at risk?
Exactly. What we work the most with is called presbycusis, which is age-induced hearing loss.
Okay, gotcha. So at what age would you recommend someone begin getting those hearing tests?
Personally, I'd recommend anyone over the age of 55, especially if they have a background with excessive noise, so construction work, engine noise, firearms, or if they have any family history of hearing loss.
And how frequent is that hearing test?
Annually.
Okay,
that's
so
what I would
annual.
recommend. Yeah,
Gotcha.
every year go in, have it checked. At least then you'll have a baseline. So if it does change, you can go back and find out when it did.
Gotcha. That's a good point.
Yeah.
So let's say someone suspects that they do have some hearing loss. They come in for an examination. Take us through that examination. What does it involve?
Sure. So first we would want to find out as much as we can about their hearing health. So we'd go through a detailed history of any family hearing loss that they may know of, any perforations in the eardrum. What we would do is actually look in, see for perforations, check for the health of their ear canal and the eardrum, look for any infections that might be causing hearing loss, go over any allergies that they may be suffering from, head colds, things like that. From there, that's called otoscopy. So we use an otoscope to look in the eardrum or the ear canal. So what we would do from there is we'd go into testing your hearing. We go through all of the frequencies that are found in speech and conversations and compare that with where they should be. So what the average or what the acceptable amount of hearing is, and we'd want to compare where your scores are. And from there, if there is a hearing loss, if hearing aids are a good option for you, we'd go over the different styles, what would work best for your situation.
So you test those frequencies, against each other, because I imagine someone might have hearing loss in one frequency, but hear perfectly fine in any other frequency. So, they might suspect something's wrong, but they're not quite sure.
You're exactly right. It's not usually just a flat loss across the board. There's some variations. That's why it's important to really see which frequencies you're hearing, which ones you're not.
Okay, and that takes us to the hearing aids, because you can you can program that hearing aid to specifically address that frequency. So how do those hearing aids work?
Well, there's a few different styles when it comes to hearing aids. I brought two actually. I'm wearing them. So this is one. It's a very popular style.
Wow.
This is a behind the ear hearing aid.
Okay.
And the speaker is actually on the tip here, so that goes in your ear canal.
Gosh, that is tiny.
Yeah, they've come a long way in the last few years in their size. And this is another style, so it's a little bit different. This one goes completely in your ear.
But still very discreet.
Exactly.
You don't have that huge thing wrapping around your ear like years ago.
Exactly. They've changed a lot. That was a big concern for people and prevented them from getting hearing aids, is how obvious they were in the past. So they've changed a lot in their size, but they basically function in the same way. They take the signals going into the microphone, convert them into electrical signals, which pass through an amplifier. They go through the speaker, and they're delivered into your ear canal. So that's the big difference between hearing aids and hearing amplifiers. You might see hearing amplifiers on the shelf of Walmart, or big box stores. What they do is they amplify everything. So as we mentioned earlier, with different amounts of loss at different frequencies, that's not the best option.
Gotcha.
It can actually damage your hearing if we're over amplifying frequencies.
Certain frequencies, sure.
Yeah, so the idea with this is we would go in, find what your prescription hearing loss is. We connect these with our software, program them for your hearing loss. So they're really tailor-made for each individual.
Yeah, they're customized based on that individual's hearing loss.
What's really neat now is most of them are Bluetooth. So you can actually connect them with your cell phone.
That's awesome.
You can connect them with your TV. You can stream phone calls and audio through them. And also it allows you to make adjustments right from your phone.
That's excellent.
Really neat.
Fantastic. So you don't necessarily even have to go back into the office to make those minute adjustments.
Not nearly as much.
Excellent, excellent. So the big question, I'm sure you get asked a lot.
Yeah.
How much do they cost?
Well, the industry average is $2,500 per hearing aid.
Well, that's not bad.
Yeah, it can be high.
Sure.
At Here For You, we're literally half that cost.
Oh, wow.
Yeah. So, and now we've got it worked out where you can pay less than $50 a month and have the latest technology.
Okay, payment plan.
Yeah, exactly. The latest technology. And then with that plan, every 5 years, you get a brand new set with whatever the technology is that year.
Oh, excellent.
Yeah.
So you get an upgrade just like you get with your phone or something.
Exactly.
So are they covered by insurance?
It depends. There's some insurance companies that cover them completely, some that cover a portion. It just depends. So the best way is just to give us a call. We'll go over the plan with you and see what we can do.
But I mean, to me at least, because my father suffers from hearing loss, and you really cannot put a price on being able to interact with your grandkids, on being able to go out to a noisy restaurant and understand the person that you're with, because hearing loss has huge social ramifications too. You tend to isolate yourself, and it's a great way to reintegrate into society.
You're exactly right. It doesn't cause physical pain that we're used to. If it was like a toothache, people would be lined up out the door.
Right.
But it causes emotional pain.
Right.
And then just like you said, people start to isolate themselves and kind of withdraw from those situations.
So how does someone find out more and maybe schedule an appointment with Here For You if they suspect something is coming?
Yeah, well, I encourage anyone who may be suffering themselves with hearing loss, or if you know anyone that has possibly some hearing difficulty, give us a call. Encourage them to call. Our main phone number is 850-536-8780.
Okay.
We can kind of walk you through the process of improving your hearing.
And we were discussing before we came on something that I've never heard of before, which is an in-home free consultation. So not only is it convenient, but it's free. So tell us about that.
That's the idea. Trying to make it as convenient as possible. We have a pretty large territory, so obviously Pensacola we cover, but we cover Cantonment, Gulf Breeze, Navarre, all the way out to Fort Walton and Destin.
Oh, wow.
So a big territory, but a lot of people, if you can't make the drive to Pensacola, give us a call. We're happy to come to you. we can do everything from the hearing test to the hearing aid fitting right there in your own home.
Oh, really?
Yeah.
So the same basic test and service that you would get in the office, you're getting in your own home, essentially.
Exactly. We have some portable equipment.
Oh,
Yeah,
excellent.
Exactly.
Which is great because a lot of our clients are homebound, right? They can't drive, or maybe they shouldn't be driving,
Exactly.
right? So being able to offer that service at home is a huge benefit.
Exactly.
Well, it's great information. Thank you so much for coming on and sharing it.
Thank you for having me.
Absolutely.
Enjoyed it.
And thank you for watching. Until next time, enjoy life. You've earned it.
Why do people love ACT's retirement life communities? There are more reasons than just the active lifestyle. Like ACT's Life Care, a plan that protects your nest egg with predictable monthly fees, even if your healthcare needs increase. So you can enjoy a carefree today and a worry-free tomorrow. Plan a visit and see why our satisfaction rating with current residents stands at 98%. ACT's Retirement Life Communities, where loving kindness lives.
What does it look like when a life is truly changed?
I feel a sense of accomplishment because I built a house. This house has brought us financial independence.
It's a great place to raise a family.
Strength, fuerza. When I look back where we've come from to where we are today, it makes my heart very happy.
Potential, potencia.
For me, this house means all of us together.
Security.
Security.
Every family dreams to have their own house. This house changed our lives.
Habitat for Humanity is at work in your community and around the world. Through shelter, we empower.
Since 1989, TLC Caregivers has been providing the special help people need to stay independent in their own homes. TLC is an employer of choice in the home care market. Our employees are screened with level 2 background screens, drug-free, and have caregiving experience. If you have time, enjoy people, and are interested in joining us, go to tlccaregivers.com to learn more about becoming a TLC caregiver, or visit us in Cordova Square.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.